This is Sunnee Serotonin. Joining us is,
Dr. Heather Kruse. I'm a clinical psychologist at KU Med.
as an introduction, what made you choose your profession?
Well, growing up, I knew several people who had serious mental illness, and I saw firsthand how helpful it could be to just show support and listen. Even if you couldn't fix the problem, there's something very healing in having another person show up for you.
What are the subtle early warnings of suicide that friends or family might miss?
Well, one of the things that people tend to dismiss as a warning sign is if someone is talking about suicide. There is a myth that if someone is talking about suicide that they are not seriously considering it, but that is not true. Many times when people talk about suicide, it's because they are ambivalent. They have not made up their mind yet. And suicidal ideation can change from moment to moment. So someone might talk about it because in the moment they're unsure, but later change their mind and decide to act on that ideation. So I would say anytime someone mentions suicide or depression or feeling hopeless, to always take them seriously.
Yeah, and I think that's interesting because we had a couple suicide presentations in our school, and the counselors really talked about how statistics show that teen suicide is often a decision made in less than 20 minutes. So
That is true. And it's often impulsive, regardless of age, but especially for teenagers. So, one of the best things that people can do as a preventative is to get rid of anything that they could easily access in those moments of impulsivity. So, that's why locking up guns or deadly medications or poisons can be so beneficial because anything that can slow a person down can give them an opportunity to think through if they really want to go through with the act. That's also why suicide prevention hotlines are so helpful because just talking to someone for a brief period of time could be enough to make a person decide that they're going to keep on living. It won't fix all their problems, but that intense urge to hurt themselves might pass.
what are the risk factors of suicide?
So, being socially isolated, any kind of history of abuse, being uneducated or undereducated, being unemployed or underemployed, not having good access to healthcare, having a stigma about around mental health, and living in a rural community where it is less common to have access to mental health services. All of these things put a person at a higher risk.
How do you safely approach someone you suspect is struggling without making them feel interrogated?
I think just be honest and genuine and let them know that you care about them and it seems like they might be having a hard time, and ask them, like, is there anything that you could do to help get them connected to help? Also, really normalize it. A lot of people experience depression or anxiety or other mental health concerns. A lot of people experience suicidal ideation. It is not a moral failing. It is not something that a person can just will their way out of. It's a pretty common human experience. And so let the person know that you care, that you see them, and that they matter to you.
Is it true that asking directly about suicide can put the idea in someone's head?
No, that is another myth. So someone who is thinking about suicide isn't going to suddenly decide to go through with it because someone asked about it. On the contrary, it is more likely to get that person to open up and realize that someone cares about their well being. So, a person who is not thinking about suicide will not decide to harm themselves because someone asked. There is no harm in asking as long as it's done from a genuine place. with the person's best interest in mind.
What are the protective factors of suicide? So, what can people consistently do to lower suicidal ideation?
So, having a good social support network, and that especially includes family support, but also this is a community problem. So, we know that in communities where there is unemployment, where there's poverty, where there's not access to healthcare, that people have higher suicidal ideation. So, really, this needs to not just be something that we look at from an individual level, but also from a community level. How can we build stronger communities where people have the supports they need to live healthy, happy lives? And if they are struggling, how can we set them up to get the help that they need?
What does a suicide safety plan look like, and how can we help someone create one?
So there are a lot of different variations of a safety plan, but most of them tend to include identifying for the individual, like what are triggers for them? What are signs that they might be starting to think about suicide or self-harm? Because it's going to be individual for each person. And then some distraction or coping techniques that they could try. Then, if those don't work, who are people that they could call? And we want to get very specific, not just family, friends, but who is the name of the person that you're going to call if your coping techniques don't work? What's their phone number? Do you have it programmed in your phone? And then last, having the suicide prevention hotline on there, which is pretty simple. It's 988, or, encouraging people to call 911 if all those other things are not effective.
What are the most effective based treatments? Sorry, what are the most effective evidence-based treatments currently used in Kansas to treat suicidality?
So, one of the best things that people can do is get rid of access to lethal ways to harm themselves. Because, like we talked about a moment ago, anything that slows a person down, if they have to go to another room to unlock a gun safe, if they have to go somewhere else to get the ammunition, anything that can slow a person down, those are minutes that could help the person rethink their decision to harm themselves. And also, the availability of the suicide hotline is a great thing. We've had it for a very long time, but it used to be a long 1-800 number, which is not easy to remember. Now it's 988, and we have billboards, we have signs in parking lots, we have bumper stickers. It's a lot easier for people to remember in those moments of crisis. Oh, that's the number I can call.
How can we support someone who is experiencing high-functioning suicidal ideation? So that's looking fine on the outside.
Normalize that everyone struggles, even if it seems like everything is going well, even if they don't have a quote unquote reason to feel depressed or suicidal, that sometimes those things happen. And it's okay to ask for help. And it's imperative that they ask for help because there's a lot of people who care about them.
What advice do you have for suicide loss survivors in our community trying to cope?
I would say, first of all, it's not your fault. None of us can stop another person from doing anything. You can be the most loving, supportive, caring person in the world, and sadly, someone you know might still die by suicide. So know that it's not your fault and know that you're not alone because there's a lot of people out there who have been affected by suicide as well. There are support groups available. Some are online, some are in person. If that's not your thing, individual therapy could be beneficial. And I would say also just keep in mind that if you have lost a loved one to suicide, that could put you at a higher risk for suicide as well. So do not neglect your own mental health. So make sure that you also are asking for help if you need it.
How can schools, workplaces, and faith communities in Kansas foster better mental health dialogues?
I think it goes back to normalizing it. There is research that shows one of the biggest barriers for people seeking mental health care is stigma, being afraid that their family or friends or neighbors will find out that they're seeking help for a mental health disorder. So, letting people know that it's okay, that is something a lot of people experience, and that the way that they're feeling right now won't last forever. So if they're feeling really depressed in this moment, if they are feeling like maybe self harm or suicide is the answer, remind them that those feelings will pass and to give themselves a chance to see if things could get better.
This is Sunnee Serotonin. Thank you for listening, and we'll see you again in the next episode.